20 celebrity plastic surgery, disasters that went too far. Money can buy access to the best doctors, the most advanced technology, and almost any cosmetic procedure imaginable. But when the desire to change your appearance becomes relentless, even fame and fortune cannot guarantee a perfect outcome. Plastic surgery has a long history, and when performed by qualified professionals, many procedures can be safe and successful. Yet complications, unrealistic expectations, repeated operations, and unregulated treatments can sometimes produce devastating results. Today, we're looking at 20 extraordinary stories involving celebrities, public figures, and people who became famous because of their dramatic transformations. Some openly admitted their procedures, while others became the subject of speculation based on photographs and public appearances. The stories range from dangerous injections and excessive surgery to procedures that simply produced results the person later regretted. And in several cases, the consequences went far beyond appearance. Number 20. Hang My-Oku. Hang My-Oku's story remains one of the most disturbing examples of cosmetic surgery obsession. Once a model and singer, she became increasingly focused on achieving what she considered perfect skin. Her interest in cosmetic procedures eventually became so intense that doctors reportedly refused to perform additional operations. After returning to South Korea, Hang sought another practitioner and eventually obtained silicone and syringes. When she could no longer obtain the material she wanted, she reportedly began injecting cooking oil into her own face. The result was catastrophic. Her face became severely swollen, scarred, and permanently disfigured. Her story attracted enormous public sympathy, and donations helped pay for corrective operations. Doctors performed a series of procedures to remove some of the foreign material and reduce the swelling, but they could not completely restore her original appearance. Her experience became a powerful warning about the dangers of unregulated injections and the psychological consequences that can accompany an obsessive pursuit of physical perfection. Number 19. Mickey Rourke. Mickey Rourke's relationship with cosmetic surgery was different. His transformation was initially connected to injuries rather than simply a desire to look younger. During his boxing career, Rourke suffered serious facial injuries, including broken noses and damage around his cheekbone. Reconstructive surgery became necessary, but he later expressed dissatisfaction with some of the results. That dissatisfaction contributed to additional operations, including multiple procedures on his nose and treatment around his cheek. Over the years, his face changed dramatically, becoming almost unrecognizable compared with his younger appearance. Rourke has spoken candidly about regretting the choice of surgeon for some of his reconstructive work. His experience demonstrates how complicated facial reconstruction can become when injuries, repeated procedures, and dissatisfaction collide. Number 18. Anastasia Pokrachuk. Anastasia Pokrachuk became internationally recognizable because of her extraordinarily prominent cheeks. Unlike many celebrities who keep their cosmetic procedures private, Anastasia has openly discussed her use of facial fillers. What makes her story particularly unusual is that she has reportedly administered some of her own fillers. She has described researching the process herself and maintaining what she considers appropriate hygiene practices. Medical professionals have warned about the dangers of injecting fillers without proper medical training. Incorrect placement can damage blood vessels, cause infection, produce tissue injury, or lead to other serious complications. Yet Anastasia has remained committed to her appearance, even expressing a desire to have exceptionally prominent cheekbones. Her story illustrates how dramatically personal definitions of beauty can differ, and how easily cosmetic enhancement can turn into an ongoing cycle. Number 17. Raji Naranizing. Raji Naranizing's story is less about conventional cosmetic surgery and more about the dangers of unlicensed practitioners. The actress and transgender activist appeared on the television program Botched after suffering severe complications from injections she believed would help feminize her appearance. The substances reportedly injected into her face and other parts of her body were not legitimate medical fillers. Instead, the material was described as a dangerous mixture that included substances such as industrial silicone and other inappropriate ingredients. Over time, her body reacted by developing swelling and hard nodules. The emotional consequences were devastating. Raji reportedly became ashamed of her appearance and withdrew from public life. Eventually, Medical treatment helped remove some of the harmful material and restore part of her appearance. Her experience is a reminder that saving money on cosmetic procedures can come with an enormous price when the practitioner is unqualified. Number 16, Simon Cowell. Simon Cowell became famous for his sharp opinions, but in recent years he has also been unusually honest about his own cosmetic decisions. Cowell acknowledged that he had gone too far with facial fillers while attempting to maintain a youthful appearance. At one point, the result became so dramatic that even he recognized it no longer looked natural. He later said that his appearance had changed so much that his young son was uncomfortable with it. Cowell subsequently had some of the filler removed and adopted a more conservative approach. Instead of continuing to chase dramatic changes, he began emphasizing exercise, diet, hydration, and healthier habits. His experience is a good example of how even someone with unlimited access to cosmetic specialists can eventually realize that subtlety is often more effective than excess. Number 15, Neven Siganovic. Croatian television personality Neven Siganovic has undergone numerous cosmetic procedures throughout his career. One of his most unusual surgical experiences reportedly involved a rare medical complication following anesthesia. After undergoing a nasal procedure abroad, he reportedly developed priapism, a prolonged and painful erection associated with certain medical conditions and medications. Although the complication had nothing to do with the cosmetic result itself, it demonstrated that surgery always carries medical risks, even when the procedure appears routine. Despite the frightening experience, Siganovic continued to express interest in cosmetic enhancement, showing just how powerful the desire for physical transformation can become. Number 14, Cardi B. Cardi B has never been shy about discussing cosmetic surgery. In fact, her openness has helped expose some of the risks associated with procedures performed outside legitimate medical settings. The rapper has spoken about having but injections when she was younger and later undergoing surgery to remove problematic material. She described the experience as difficult and strongly warned her followers against repeating her decision. She has explained that social pressure and her environment at the time influenced her decision to get the injections. The procedure was reportedly performed for a relatively small amount of money in an unsafe setting. Cardi has also openly acknowledged having a nose job. Her position is nuanced. She does not condemn cosmetic surgery itself, but she emphasizes that anyone considering it should prioritize safety and qualified medical care. Number 13, Katie Price. Katie Price is one of Britain's most recognizable personalities, and she has never attempted to hide the extent of her cosmetic procedures. Her transformation began with breast augmentation and nasal surgery and continued through numerous additional procedures over the years. She has openly discussed facials, fillers, breast operations, and other cosmetic treatments. Her changing appearance has repeatedly generated headlines, particularly as the number of procedures increased. Some medical professionals have expressed concern about undergoing repeated operations so frequently. Katie's story is significant because she openly acknowledges that cosmetic surgery has become a major part of her appearance. Her journey also demonstrates how one procedure can sometimes lead to another, especially when a person becomes accustomed to changing one feature after another. Number 12, Donatella Versace. Donatella Versace's appearance has been the subject of intense speculation for decades. However, it is important to distinguish between confirmed procedures and observations made by outside commentators. The fashion designer has maintained an exceptionally distinctive appearance, and experts have speculated about possible Botox, fillers, facial surgery, and other cosmetic treatments based on photographs. Her smooth forehead, altered facial contours, and changing features have fueled countless discussions. But without confirmation from Versace herself or reliable medical records, many specific claims remain speculation. Her inclusion here therefore says less about a confirmed surgical disaster and more about how celebrity appearances become subjects of public scrutiny. Number 11, Jackie Stallone. Jackie Stallone was remarkably open about her cosmetic surgery regrets. She once compared the results of certain procedures to looking like a chipmunk carrying a mouthful of walnuts. Rather than hiding her mistakes, she discussed them publicly. Stallone also maintained an active lifestyle well into old age, participating in exercise and other activities. Her story is a reminder that cosmetic surgery does not automatically stop the aging process. Skin continues to change, Facial structures continue to age, and procedures that once looked effective may eventually produce unexpected results. Number 10. Michael Jackson. Few transformations in entertainment history have generated more discussion than Michael Jackson's. Jackson openly acknowledged having some cosmetic procedures, particularly involving his nose. However, claims about the exact number of surgeries he underwent vary dramatically, and some of the more extreme figures reported over the years have never been independently established. His appearance changed substantially from his childhood and early adult years. Reports and accounts from people around him have described procedures involving his nose, cheeks, eyelids, and chin. Whatever the exact number, Jackson's transformation became one of the most recognizable examples of how repeated cosmetic changes can dramatically alter a person's appearance. Number 9. Jessica Alves. Jessica Alves, formerly known publicly as Rodrigo Alves, became internationally known for undergoing an extraordinary number of cosmetic procedures. Her transformation involved numerous operations designed to create a highly stylized appearance. She has undergone multiple procedures involving her nose, face, body, and other features. Over the years, she reportedly spent hundreds of thousands of pounds on cosmetic treatments. Jessica has spoken about identifying with femininity from childhood and later transitioning. Her story should therefore be understood within the broader context of gender identity and personal expression rather than simply being reduced to a list of surgeries. Nevertheless, the sheer number of procedures she has undergone demonstrates how cosmetic transformation can become an enormous part of someone's public identity. Number 8. Linda Evangelista. Linda Evangelista's story is especially important because the procedure involved was marketed as a non-surgical alternative to traditional fat reduction. The supermodel underwent cool sculpting treatments, expecting fat reduction without conventional surgery. Instead, she developed a rare complication called paradoxical adipose hyperplasia, in which treated areas become enlarged rather than smaller. Evangelista said the experience left her feeling severely disfigured and profoundly affected her confidence. She eventually filed a lawsuit against the company associated with the treatment. The case eventually ended in a settlement. Her experience demonstrates that even treatments marketed as minimally invasive can have unexpected complications. Number 7. Sharon Osbourne. Sharon Osbourne spent decades discussing her cosmetic procedures openly, but after a particularly difficult facelift in 2021, she decided that enough was enough. She described the result in brutally honest terms, saying that she felt one eye looked different from the other and that the overall experience had been extremely unpleasant. The operation reportedly lasted several hours and left her questioning whether additional surgery was worth the risk. After years of facelifts, procedures, fillers, and other cosmetic treatments, Sharon eventually reached a conclusion that she could no longer keep pursuing the same cycle. Number 6. Priscilla Presley. Priscilla Presley's appearance has generated speculation for years. However, many claims about her specific procedures have never been confirmed by Presley herself. Several doctors who examined photographs suggested that fillers, facelifts, and other treatments could have contributed to changes in her appearance. Her name has also been connected to controversial cosmetic practitioner Daniel Serrano, who was accused of administering industrial-grade silicone injections. Presley later said she had been unaware of what was actually being injected. The story became one of the most notorious examples of the dangers associated with unlicensed cosmetic practitioners. Number 5. Jocelyn Wildenstein. Jocelyn Wildenstein became known around the world as Catwoman because of her highly distinctive appearance. For years, the public debated how much of her appearance was a result of surgery and how much came from genetics and personal styling. Wildenstein herself rejected many claims about the extent of her cosmetic work. Her dramatic eyes and facial contours nevertheless became one of the most recognizable transformations in celebrity culture. The fascination surrounding her story shows how quickly a person's appearance can become their entire public identity. Number 4. Heidi Montag. Heidi Montag's cosmetic surgery experience remains one of the most shocking examples of performing multiple procedures in a very short period. At only 23, she underwent a reported 10 procedures in a single day. The operations included several facial and body procedures. The recovery was extremely difficult. Montag later described feeling physically weak and overwhelmed by the experience. Over time, she became much more reflective about what had happened. She acknowledged that insecurity played a major role in her decisions and encouraged people to think carefully about why they want surgery before going through with it. Her story illustrates the difference between wanting to change something and feeling that you have to change it in order to be worthy or accepted. Number 3, Joan Van Ark. Joan Van Ark has faced years of speculation about cosmetic surgery because of dramatic differences between photographs from earlier and later stages of her career. Outside observers and some doctors have suggested possibilities, including facelifts, fillers, Botox, brow procedures, and other treatments. However, without confirmation from Van Ark herself, these claims should remain speculation. What is undeniable is that her appearance became a frequent subject of public discussion, demonstrating the enormous pressure placed on women in Hollywood to maintain a youthful appearance. Number 2, Pixie Fox. Pixie Fox took cosmetic transformation to an extreme that few people could imagine. She became famous for attempting to create a cartoon-like appearance, undergoing more than 20 cosmetic procedures. Her surgeries have reportedly included multiple breast augmentations, facial procedures, lip injections, liposuction, rib removal, and other dramatic modifications. At one point, doctors featured on Botched refused to continue operating on her because they believed additional procedures were too risky. Yet Fox remained determined to pursue her vision. Her story raises a difficult question. Where should the line be drawn between personal freedom and medical responsibility? Number 1, Zhou Chunna. One of the youngest and most controversial stories involves Chinese influencer Zhou Chunna. According to reports, she began cosmetic surgery as a teenager after experiencing bullying and believing that changing her appearance would improve the way other people treated her. Her first procedure was reportedly double eyelid surgery at just 13. After noticing changes in how people responded to her, she continued pursuing additional procedures. Reports have claimed that she eventually underwent dozens of operations, including rhinoplasty, fillers, liposuction, breast procedures, and other cosmetic treatments. Her story became especially controversial because of her age and the psychological pressures that influence her decisions. It raises a much larger issue than plastic surgery itself. When a young person begins believing that their natural appearance is the reason they are rejected, cosmetic procedures can become an endless attempt to solve an emotional problem through physical changes. And that may be the biggest lesson behind all 20 stories. Plastic surgery itself is not inherently bad. Reconstructive operations can restore function after injuries, and cosmetic procedures can help people feel more comfortable with their appearance. But problems arise when surgery becomes compulsive, when procedures are performed by unqualified individuals, or when someone keeps changing their body because they believe the next operation will finally make them happy. Behind every dramatic transformation is a real person dealing with expectations, insecurity, aging, social pressure, or personal identity. The most important question isn't simply whether someone has had plastic surgery. It's whether the decision was safe, informed, medically appropriate, and genuinely made for the right reasons. Because when the pursuit of perfection has no finish line, even unlimited money and unlimited access can become part of the problem rather than the solution.